Imagine paying, hundreds of dollars to have purified salmon sperm injected right into your face.
Oh, yeah.
And then you look in the mirror 20 minutes later and see this swollen, distinctly reptilian landscape staring back at you.
Right. If you haven't done your homework, that is a terrifying moment.
It really is. So today we are looking at a massive stack of clinical guidelines, dermatology publications, and clinic aftercare manuals. And they're all focused on one of the most explosive trends in regenerative medicine right now, which is polynucleotides.
Often dubbed the salmon sperm facial.
Exactly. And whether you're prepping for a consultation or just insanely curious about the latest in aesthetic medicine, this one is for you.
We have a very specific mission for this deep dive.
We do. We are going to cut through the hype and answer the #1 question people frantically search for before sitting in that treatment chair. Will I get bumps or swelling after treatment?
And the short answer is, well, yes, you almost certainly will.
Okay, let's unpack this. Because the anxiety around those bumps stems from a fundamental misunderstanding.
Right. Exactly. When people hear the word injectable, they instantly think of traditional dermal fillers.
Like hyaluronic acid fillers.
Right. And those act essentially like a biological sponge. You inject it deep into the tissue, it grabs onto water, and it physically inflates the space.
So it adds instant volume.
Yes, but polynucleotides do not work like that at all. We are not filling a void. We are delivering basically a biological instruction manual.
So if it's not a filler, what actually is it? Our sources explain that polynucleotides are highly purified fragments of natural DNA.
Derived from fish.
Right. The viral headlines are true. It's usually from trout or salmon because their DNA structure is remarkably similar to ours.
But the clinics emphasize that this material goes through an intense filtration process, so you aren't getting fish cells.
No proteins, no lipids, right? Just the raw, naked, genetic building blocks.
Exactly. And that purification process is incredibly critical. When you introduce those raw genetic building blocks into human skin, they function as biostimulants.
Okay, biostimulants.
Yeah.
Meaning they stimulate the biology.
Right. Instead of just sitting there taking up space like a filler, these DNA fragments actively bind to specific receptors on your cells.
Oh, wow. So they trigger a reaction.
They trigger a biological cascade. They literally tell your body to repair tissue, clear out free radicals, and start manufacturing fresh collagen and elastin.
But to get those instructions to the right cellular department, the delivery method has to be incredibly precise.
Yes, and that is exactly where the famous post-treatment bumps come in.
Let's talk about the anatomy of a dump, because the clinical literature is very upfront about this. Several clinic guides explicitly warn that you might look a little, lizard-like immediately after.
It's very true.
So why does a fluid that is supposed to be biologically compatible instantly cause your skin to break out in these massive, visible welts?
It all comes down to the depth of the injection. The specific layer of skin we need to target is the dermis.
Right, so not too deep, not too shallow.
Exactly. Think of your skin in layers. The very top is the epidermis, mostly dead and dying cells. The deepest layer is the hypodermis, which is full of fat.
And sandwiched right in the middle is the dermis.
Yes. That's where the structural matrix of your skin lives. So to get the polynucleotides exactly into that middle layer, practitioners use an intradermal injection technique.
Meaning they're placing tiny drops of this viscous gel just barely beneath the surface.
Right.
It's like planting seeds just beneath the topsoil. You can literally see the little mounds where every single seed has been placed.
That's a perfect analogy. Unlike a deep filler that gets buried under a thick layer of fat where nobody can see it, this fluid literally has nowhere to hide.
It's pooling in a very tight space.
It has no empty space to instantly disperse into, so the fluid pools right where the needle leaves it, and it forcefully lifts that thin top layer of the epidermis upward.
And that creates the bumps.
Yes. Small, firm, very visible lumps all over the treatment area. The clinical term for these is papules.
Papules. Okay, but the anxiety really hits when people get home, right? They see these papules and panic that their face is, permanently textured.
Oh, absolutely. But the timeline is actually rapid.
How long does this reptilian phase last?
Because the body recognizes the material, it begins absorbing it almost immediately. The clinical consensus is that these papules naturally flatten out within about 12 hours.
Just 12 hours.
Usually, yes. Barely guaranteed part of the process.
Okay, but just as the bumps start to melt away, another visible side effect takes over. The sources outline that the bumps are frequently replaced by redness and overall swelling.
Yes, the inflammatory response.
And I'll be completely honest here. If I'm paying good money for a cosmetic treatment to look refreshed, why would I want my face to be swollen and inflamed? It feels like a failure.
I get that. But what's fascinating here is that the inflammation is physical evidence that the treatment is actually working.
Wait, really? The swelling is a good thing.
It's essential. The localized swelling and redness aren't an allergic reaction. They are the visual markers of your body's innate healing mechanism kicking into overdrive.
I'm having a hard time visualizing this. How does a micro-injection of fish DNA trick my body into an inflammatory healing response?
Well, when the practitioner inserts the needle, they're creating controlled microtrauma. Your body flags that tiny puncture as an injury.
Okay, that makes sense.
And simultaneously, it detects a sudden influx of these new DNA fragments in the dermis, so it responds by initiating a localized inflammatory cascade.
Meaning it dilates the blood vessels.
Exactly. It forces more blood flow to that specific area, which causes the redness. Then the blood vessels become slightly permeable.
Oh, so fluid rushes out.
Fluid and immune cells rush out into the tissue to assess the situation, and that traffic jam of fluid and cells is what creates the perfect environment to wake up your fibroblasts.
Fibroblasts. We see that term in almost every single dermatology journal in this stack.
They are the holy grail of anti-aging.
But what are they actually doing when they wake up?
Think of fibroblasts as dormant cellular factories scattered throughout your dermis. When we're young, they run constantly, churning out collagen, elastin, and hyaluronic acid.
But as we age, they slow down.
They get incredibly sluggish. So the physical swelling, the rush of blood, and the signaling from the polynucleotides, it all acts as a biological alarm clock.
It forces the factories back online.
Exactly. Without that temporary inflammation, the fibroblasts stay dormant, and you get absolutely no long-term regenerative benefits.
So the swelling is literally the repair crew arriving at the site. That completely shifts how you view the aftermath.
It really does.
And diving into the product comparisons in the medical literature, it seems the intensity of that repair crew can vary wildly depending on the specific product.
Yes, the two dominant formulations in the clinical data are Filart and Plynest, and they are engineered very differently.
Let's break those down. Starting with Filart, the sources say this one is generally used for younger patients, early-stage aging, or delicate areas like the under eyes.
Right. Filart utilizes a slightly gentler formulation. Because it's designed for broader hydration, the initial inflammatory response tends to be milder.
So less swelling.
Typically, yes, the body digests it more smoothly. But then you have Plynest.
Which the clinics reserve for more mature skin or severe acne scarring.
Plynest uses high-purity technology, or PNHPT. It's a denser, more structurally robust formulation designed for deep tissue stimulation.
So it forces a heavier biological cascade.
Exactly. And because it's addressing deeper damage, the localized swelling and inflammation are often significantly more intense.
But either way, you're getting that 24 to 48-hour inflammatory response.
Yes, both trigger it.
So what does this all mean for your evening plans? You leave the clinic, your face is bumpy, you know you're going to wake up puffy. How do you manage this healing phase?
Well, the clinic sends you home with a terrifyingly strict list of aftercare rules.
Seriously strict. And it makes sense. You've just punched hundreds of microscopic holes in your skin.
Right. How you behave in the next 48 hours dictates whether you heal beautifully or develop a severe complication.
The absolute non-negotiable golden rule across every single source is do not touch, rub, or massage the bumps. But human nature makes you want to press them flat. Why is touching them so dangerous?
Two major reasons. First, the gel is placed in a very specific shallow layer. If you press on those pacules, you push the product out of the targeted dermis.
You ruin the aesthetic result.
Exactly. It disperses unevenly. Second, your hands are covered in a biofilm of bacteria. Pressing on fresh, unsealed needle tracks drives bacteria directly into your internal tissue.
Which causes infection.
It is the primary catalyst for post-treatment infections. You just have to let the tissue absorb the gel at its own pace.
The clinical guidelines do offer a toolkit for the swelling, though, like using a cold compress to soothe redness.
Yeah.
But they explicitly ban raw ice.
Yes, never apply ice directly to the skin. Freezing the tissue can actually cause necrosis. A gentle, cool compress is enough to constrict the vessels.
And they completely ban exposure to heat. No saunas, no hot showers, no intense workouts for at least 48 hours.
Heat naturally dilates your blood vessels. If you force vasodilation in an area already experiencing massive inflammation, you will exponentially worsen the swelling.
You're just doubling your downtime.
Exactly.
There's also the rule about keeping it sterile. No makeup for 6 to 24 hours. Smearing foundation into open micro wounds is begging for a breakout.
Right. And you have to bench your active skincare routine too. No AHAs, no retinoids.
Because the needles bypass the skin's protective shield.
Yes, the stratum corneum usually handles strong acids, but the needle created a direct highway to the delicate dermis. Acid down those microchannels causes severe chemical irritation.
Yikes. Finally, let's talk bruising. The guidelines say you must avoid blood thinners for a full 24 hours post-treatment.
No aspirin, no ibuprofen.
And sadly, no post-procedure glass of wine.
Right. Whenever a needle enters the dermis, it nicks tiny capillaries. If your blood is clotting normally, it seals instantly.
But if your blood is thin from alcohol,
That microscopic nick continues to quietly bleed beneath the surface, turning into a massive dark purple bruise. You have to give your vascular system an uninterrupted window to patch those vessels.
okay, so 12-hour bumps and 48-hour swelling are just normal healing. But how do you know when a symptom crosses the line?
This raises an important question.
Right, where is the boundary between a standard healing phase and a red flag where you need to call your doctor?
While polynucleotides have an incredibly high safety profile, we are still breaking the skin barrier. So we have to look at the rare but real adverse events in the medical literature.
Let's start with granulomas. The terminology sounds terrifying, but the sources make it clear that a granuloma is entirely distinct from a normal day one bump.
Absolutely. A standard papule is just the gel sitting in the tissue absorbing in a day. A granuloma is an immune system malfunction.
Which happens weeks or months later, right?
Yes. The body suddenly misidentifies the absorbed material as a dangerous invader. It decides to build a hard, microscopic wall of cells around the area to quarantine it.
Wow. And that presents as a firm, localized nodule deep under the skin.
Exactly. Now, because polynucleotides are so highly purified, granulomas are exceedingly rare compared to older synthetic fillers. But if you feel a hard lump weeks later, it requires medical intervention.
Usually a steroid injection to dissolve it.
Yes.
What about infection? What are the actual signs that bacteria took hold?
Normal swelling peaks around 48 hours and then subsides. An infection follows the opposite trajectory. It develops a few days post-treatment and aggressively worsens.
So, prolonged warmth, severe throbbing pain.
Radiating heat, pain that wasn't there on day one, and the presence of pus at the injection sites. This usually points to poor aftercare or an unhygienic clinic environment.
Then there's the big one, the complication that strikes fear into everyone, vascular occlusion.
It is arguably the most severe risk in aesthetic medicine, though again, incredibly rare with superficial intradermal injections.
This happens when the gel blocks a blood vessel, right?
Yes. The practitioner misjudges the anatomy and injects directly inside a vessel or tightly against it, pinching it shut.
The tissue is literally starved of oxygen.
The warning signs are instant. Sudden, excruciating pain, and the skin in the affected area will instantly blanch.
Blanching, meaning it turns completely white or gray.
Yes, the blood supply is cut off. This is an absolute emergency. The practitioner has to flood the area with dissolving enzymes immediately.
To restore circulation before the tissue dies.
Exactly.
The last rare risk is allergies. The manufacturing strips away proteins, but this is still derived from fish.
If a patient has a severe anaphylactic fish allergy, there is a minute theoretical risk that a microscopic trace of protein survives.
Ethical clinicians just won't treat those patients.
The risk simply isn't worth taking. And frankly, all these rare risks point to a singular takeaway. Choose a highly qualified, CQC-registered medical professional.
It is non-negotiable. You are not getting a facial, you are undergoing a medical procedure.
Exactly.
But here's where it gets really interesting. Just as I thought I had a handle on under-eye bags, the sources threw a massive curveball.
Oh, the intimate rejuvenation applications.
Yes. The exact same fish DNA protocol is being used for vaginal and intimate rejuvenation.
It's a profound breakthrough for women's health. Historically, options for degrading intimate mucosal tissue have been limited to localized hormone therapy.
Right. For women dealing with Genitourinary Syndrome of Menopause, or GSM, the sources describe a devastating loss of quality of life as estrogen plummets.
The tissue's structural integrity collapses. It becomes painfully thin, fragile, and chronically dry, leading to severe discomfort and dyspareunia.
Painful intercourse. We also see similar collapse postpartum. So how does injecting fish DNA fix a lack of estrogen?
It bypasses hormones entirely. When polynucleotides are injected into the mucosal layers, they find the local fibroblasts and force them to rebuild the extracellular matrix.
Just like on the face.
Exactly. The tissue manufactures its own fresh collagen and elastin, restoring thickness. Furthermore, the DNA promotes angiogenesis.
Creating new microblood vessels.
Right. This massive increase in local circulation naturally restores the tissue's ability to lubricate itself.
And it does all this without introducing a single hormone. For oncology patients or women who can't take HRT, this is huge. You're just handing the cells a blueprint and demanding they rebuild.
It's purely structural regenerative repair.
But that brings us back to our core question today. If the biological process is the same as the face, do you get bumps and swelling down there too?
Yes, the localized tissue response is fundamentally identical. Patients will absolutely experience those same small papules.
And the swelling.
Because the vulvovaginal area is incredibly vascular, the inflammatory swelling and redness can be quite pronounced, along with tenderness and pinprick marks.
I can only imagine how uncomfortable that is. And the aftercare is unbelievable.
Wow.
You thought avoiding a hot shower was tough. These clinics mandate 72 hours of total pelvic rest.
The environment is entirely different. It naturally endures constant friction and moisture. Pelvic rest means no sexual intercourse, using only mild cleansers.
And entirely eliminating physical activity that causes direct friction. So no spin classes, no biking.
Right. You have to give that sensitive tissue an undisturbed window to navigate the inflammatory cascade. Friction drastically worsens swelling and invites infection.
So the journey is universal. Whether it's the fine lines around your eyes or intimate areas, you endure a brief, bumpy, swollen window before cellular repair makes it significantly better.
The swelling is the non-negotiable toll you pay for the biological regeneration.
Let's summarize. If you decide to try polynucleotides, don't panic when you leave looking a bit reptilian and swollen. It's not a botched filler job.
It is the biological blueprint of tissue repair in action. Let the biology do its heavy lifting.
But as we wrap up, I want to leave you with a concept that extends far beyond aesthetic recovery. The reason this works is due to something called spectral biocompatibility.
Right. Our immune system looks at the raw genetic structure of salmon DNA, and it doesn't see a foreign invader. It recognizes it as a deeply familiar set of instructions.
We are literally using a marine blueprint as a biological skeleton key to unlock human cellular factories, tricking them into reversing the clock and healing trauma.
It's remarkable.
It really is. And it forces you to wonder if the purified DNA of a fish has this profound ability to rewrite our skin's aging process without triggering our immune system. What other untapped genetic blueprints might be hiding in the animal kingdom waiting to unlock the next frontier of human regenerative medicine? We will leave you to mull that one over. Until next time.